The COVID-19 pandemic is the biggest global crisis in a generation since the World War II ended in the mid-1940s. As the virus continues to cause mayhem worldwide, with several countries under lockdown, South Korea, along with China, has emerged as a beacon of hope for successfully containing the outbreak without entirely shutting down its economy, despite the fact that it was among the first countries outside China where the virus spread. So, how did South Korea achieve this? To know more, we have with us Ms. Seon Kui Lee, Director of the Division of Risk Assessment and International Cooperation at South Korea's Center for Disease Control and Prevention. Welcome to this interview with CGTN, Ms. Lee.
Thank you. Thank you for inviting me.
So, South Korea's success in containing the COVID-19 outbreak is being lauded by the international community. Many countries are devising their plans based on the South Korean model. Can you briefly describe what this model entails?
Well, actually, as we all may know already, the biggest challenge we have, the world actually have faced and is still facing, is that we still do not perfectly understand this novel virus. We believe that the measures that we have taken are not much different from all other countries have taken. However, the lack of knowledge makes us very difficult to take appropriate public health response measures. Under such circumstances, actually, we have really studied and investigated hard to know about the characteristics of this novel virus with our experts. Moreover, we considered all kinds of scenarios in advance and prepared for every possible approaches or measures to control the outbreak situation according to the worst scenario, actually. Then we concentrate on early detection by massive testing and rapid case finding, as well as active contact tracing, which is followed by early isolation and quarantine to stop the further spread by blocking the epidemiological link. The prevention and suppression of the outbreak was the key measure that we learned from MERS outbreak in 2015. In addition to these containment measures, when we had this big cluster-related outbreak from late January, the honest nationwide social distancing campaign also slowed down the locally acquired infection.
So, how do you look at the way China, for instance, which has a substantially more population than South Korea, handled the outbreak? And did the prevention control measures taken in China, including the unprecedented lockdown of Wuhan and Hubei province, have some bearing on the strategies that South Korea eventually unveiled?
I think the outbreak situation in China was quite different from the other countries. They had to fight against the newly emerging disease from novel virus, which has no source or no cause from the beginning. When they have found that human-to-human transmission is very much significant, I think the lockdown of Wuhan might be inevitable. From China's experience, we could consider the right measures that could be implemented in Korea, not the same, but the more kind of efficient one under our circumstances. I think it's China's great job for us to know in advance to how to prevent this COVID-19.
Right. So we also noticed that South Korea actually went for aggressive testing right from the initial stages of the outbreak, something that many other countries have found difficult because of the shortage of testing kits, for instance. So how did your country tackle the issue of testing, and what can other countries learn from your experience?
Actually, the relatively fast expansion of testing capacity was made possible thanks to active collaborative efforts between government, academia, and private sector. Korean government, actually KCDC, quickly developed a test and disclosed it. Actually, we could develop this testing kit from the DNA sequence sharing by Chinese government. Based on this, a company developed and produced diagnostic reagent in private sector. Upon evaluation by government and academic experts, The reagent was granted emergency use authorization by the Ministry of Food and Drug Safety very fast, because we had this kind of emergency procedure prepared, actually previously made for this kind of public health emergency preparedness. Testing facilities across the nation then began using the test. To ensure the accuracy of the tests performed, COVID-19 testing centers are selected from testing facilities that had been certified for outstanding quality. They also received additional training and passed accuracy tests to qualify. Testing quality of each center is also currently maintained by quality assurance by government and academic experts. Actually, all this kind of network was already prepared before this COVID-19 outbreak. Actually, we learned this kind of lesson from our experience in MERS outbreak 2015. So we could be much more and earlier prepared.
Right. So some of these measures that South Korea very successfully undertook, like aggressive testing as well as contact tracing, this becomes a bit difficult in some of the countries, particularly with less resources. Also in countries like India, for instance, which has a huge population, to actually go for an aggressive testing and contact tracing of all the population becomes quite a huge task. So what do you think could be the alternative for those countries?
From the public health perspective, if you have limited resources, you have to always prioritize what you could do, or what you would just apply to the people. Maybe for the testing, you have to prioritize who would get tested and tested first. You should evaluate the risks in your country very carefully and find out the high-risk groups and vulnerable groups. Then you have to take any containment measures to them at first. Also, you have to clarify case definition for testing in priority because we have limited resources. Not only testing, but also contact tracing is very important. Early finding and early quarantine would be much more effective to prevent the risk spread. Because you cannot test, but you can just see these contacts, and then if they develop symptoms, you can go for the priority and so on. So from the beginning, the KCDC also had this kind of plan. When we have limited resources, how we can prioritize our resources. And also, you can also consider the alternative testing methods, but we still have uncertainty for that. I think, have to develop more about this because we have to need some kind of a rapid testing kits or some other alternative testing kits. I think all the countries should work on this together to find out better testing methodology as well.
Right. So now many countries have gone for between partial to complete lockdown, which has had, or which is actually having a huge impact on global economy. South Korea actually didn't go for such lockdown. So how did South Korea maintain a balance between quarantine and social distancing on one hand and continue with economic activities and production on the other?
We have managed to control the spread without lockdown of a city or strict move restrictions for the public. It is mainly because of hard work of healthcare workers in private sectors, actually, and also active participation of public in keeping the distance with other individuals. We've learned, our public also have learned about this kind of behavioral approach from our MERS outbreak in 2015 as well, because we could learn that our behaviors may harm our families or our friends and all other people in our country. So people were really aware of that. From when we had this big cluster in Daegu, actually we didn't have a much stronger the social distancing campaign. We only had this kind of social distancing campaign, but our Daegu citizens And the citizens in Gyeongbuk provinces, they followed these rules so well. And then I think we could contain this outbreak, these clusters in Daegu at the time. And also some other regions, all the citizens actually had followed these rules. And then their public compliance was really high in Korea.
Last week, we also saw reports of about 51 South Korean COVID-19 patients were tested positive again after their recovery. So, and there are these sporadic reports of such a relapse from other countries as well. So, in your expert opinion, how credible do you think is the threat of a second round of outbreak?
Actually, it's really hard to predict the future situation with this kind of limited resources. So limited information, I mean. So we are considering about the maybe some kind of local transmission, which can go very silently. Maybe it can be transmitted by the asymptomatic people or just some people with little symptoms. They don't recognize they are infected, but with these little symptoms, some other people can be infected, and then all these kinds of things may also lead to the big cluster like Daegu cluster. So we are also very much concerned about these outbreaks. So we are currently concentrating on the containment measures as we've done. We have continued to exercise till now. That's the early detection and early containment would be much better to prevent the further spread of the outbreak.
Right. And also, in your expert opinion, do you think there is a timeline for this global pandemic to weaken, perhaps, and people going back to their normal life, which most people are hoping, or do you think the lifestyle changes that COVID-19 has brought are basically irreversible now?
Yes, unless there is a development of effective vaccine or treatment, the situation is likely to continue. And I don't think there is a certain time frame that we can confidently say that this is going to be over and so on. Actually, our government is also considering about how we can just have a sustainable life, normal life under this kind of COVID-19 risk. So we are considering about the sustainable social distancing, which can some ease our people's life a little more, but they can be also protected and prevented from the COVID-19 infection. So our government is now preparing for the people to go back to a new normal life. Not the life that have been before, but the new normal life might be a little bit restrictive, or maybe it's inconvenient, uncomfortable. But we, I think, should endure certain things to be adjusted to this new normal life. So that's our the next step forward. And then for this sanitation perspective, of course, we could be much more cleaner and more infection prevention control measures have been taken all the time, and this might also decrease some other diseases, infectious disease infection as well. So all these were very positive ways.
Right. So on that positive note, we will conclude this interview. Thank you very much, Ms. Lee, for talking to us and sharing your valuable insights on the fight against COVID-19.
Thank you.